Medicaid past, present, and future. Hi everyone, my name is Lauren Martinez, and I will be doing a presentation for U.S. healthcare delivery for Dr. Janet Bonomi. We'll be conducting an examination of this vital U.S. health system. So what exactly is Medicaid? Medicaid is a public insurance program that provides health coverage to low-income families, including children, parents, pregnant women, seniors, the blind, and disabled. Here we have a graph that depicts the breakdown of the population who receive Medicaid coverage. As you can see, children take over the largest percentage of the population, with the aged and the disabled and adults making up the rest. However, not all low-income families qualify for Medicaid. Some exceptions are adults over 21 without children and adults over 21 without disability. Medicaid is an entitlement program. So what exactly does that mean? An entitlement program is a government program that guarantees certain benefits to a particular group or segment of the population. How did it begin? Authorized by the Title 19 of the Social Security Act, Medicaid was signed into law in 1965 by President Lyndon B. Johnson. Johnson's social reform movement was part of the Great Society, which aimed to eliminate poverty and racial injustice. How is this program funded? So Medicaid is unique in nature in that it's funded jointly by federal government and individual states. The federal government contributes at least $1 for every $1 a state spends, and the poorer states receive more government funding while the richer receive less. $476 billion were spent on Medicaid in 2014. And how does reimbursement work? So the Medicaid system doesn't provide the service. Instead, they contract providers and in turn reimburse the providers. So states pay participating providers through a fee-for-service agreement or through capitation and health maintenance organizations. The federal government then reimburses each state for a percentage of their share of the Medicaid expenditure. The federal medical assistance percentage changes each year, and it depends on the state's average per capita income level. Eligibility. So why does Medicaid eligibility vary from state to state? And the answer lies in the fact that the state government jurisdiction allows for significant variance. Like we said, the program is dually funded. So that means that states have a significant amount of control over who they insure. The CHIP program. CHIP stands for Children's Health Insurance Program. CHIP is an expansion of the Medicaid program that came into act to provide coverage for families with incomes too high to qualify for Medicaid, but who could not afford private coverage. CHIP was created by the Balanced Budget Act of 1997. Like Medicaid, the program is jointly state and federally funded. The CHIP program's name actually varies from state to state. Here in New Jersey, where I reside, the CHIP program is referred to as New Jersey Family Care. What benefits are included in Medicaid? The federal law requires that certain services are covered. That includes inpatient and outpatient hospital, laboratory services, radiology, family planning, physician, midwife, nurse practitioner services, and nursing facilities and home health care for adults over 21 that are disabled. Early periodic screening, diagnostic, and treatment services for children under 21. So basically, those are your well child visits, immunizations, and additional services states may choose to cover. So all states choose to cover certain of these services, and they include prescription drugs, dental services, vision care, hearing aids. So the coverage debate. In healthcare, we all know that there are two sides to every coin and many opposing views. So some of the ones that are the biggest are regarding should the poor have a right to health care? Should a mandatory work requirement be instituted? And should basic human right or earned privilege? How do we view it? How do you view it? Do you think that healthcare is a basic human right, or is it an earned privilege? A law was passed in 2018 that allowed state governments to basically make that decision and allowed them to potentially tie coverage to work requirements. In return, a group of Kentucky residents recently won a lawsuit against Medicaid work requirements. The group consisted of 16 people, many of who were disabled, and stated that they could not work due to their diseases and their ailments, and therefore it was unfair to require them to do so in order to receive the coverage that they so desperately needed. So the current Trump administration is critical of the Obama administration, which they feel did little to empower the poor with tools to move out of poverty. That tends to be the case on Republicans usually wanting to instill some sort of work requirement and Democrats feeling that basic human right is health coverage. So there were states that were proposing this requirement, and there were 10 of them that we have listed here. So Arizona, Arkansas, Indiana, Kansas, Kentucky, Maine, New Hampshire, North Carolina, Utah, and Wisconsin. And the guidelines stated that adults 19 to 64 would be required to work. They would have to be able-bodied, not medically frail, and not caring for young children or disabled family. There were also other options that could be used in lieu of the work requirement. If you did volunteer work, if you cared for an elderly or disabled family member, if you were a full-time student, if you were enrolled in job training, or if you were actively searching for work. What are your thoughts? Do you feel that we should have to have work requirements? Work requirements such as this would basically parallel a working employee that would receive private healthcare coverage through their employment. So proponents of work requirements feel that gainful employment produces good health, while critics of this state that good health is a prerequisite for employment. So what do you think comes first? The chicken or the egg? Gainful employment produces good health, or do you need good health in order to be gainfully employed? Not an easy question. So challenges of Medicaid. Medicaid is a counter-cyclical program, and what exactly does that mean? That means that during economic downturns, jobs are lost, the economy goes down, unemployment rates increase, state revenue decreases, and enrollment increases. This creates an increased financial burden. This financial burden, in turn, creates another cycle. In order to offset this financial burden, providers reduce reimbursement. And that creates two effects. Providers elect to no longer participate, or providers are faced to see more patients. As a result, the accessibility and quality of care to patients suffers. Here we have a cartoon on the side which depicts a skeleton waiting in a doctor's office. I'm sure many of us can relate to this. Many doctors are overworked, and while patients often feel that doctors are being greedy and overbooking, the true reality is that reimbursement has been suffering significantly in recent years. In order to keep up with the huge overhead of a practice, doctors often have to see many more patients than they feel comfortable treating. So there are many positive effects of Medicaid coverage on U.S. society. And one striking study that I came across was a study that was conducted on children born between 1980 to 1986 to low-income women that found a significant correlation between access to health care early in life and increased socioeconomic well-being later in life. So down here we have a quote by Michelle Obama that I think resonates especially with this study. And it says, the communities and countries are ultimately the world are only as strong as the health of their women. If we are able to provide healthcare for women and for newborns and provide them with the coverage that they need, we will have a much healthier and more productive society in the future. So the Medicaid expansion under the Affordable Care Act and how it relates. So to date, 27 states, including Washington, D.C., have implemented the expansion. And how is the Affordable Care Act impacting Medicaid? As of March 2014, Medicaid and CHIP enrollment grew by more than 4.8 million people. And 3 Affordable Care Act changes have led to Medicaid enrollment increasing and improving. They include Medicaid expansion to low-income adults, so more people qualify. Number 2, be more modern and simpler enrollment process. Gone are the days of having to wait in a Medicaid office, filling out papers by hand, tedious wait times, tedious paperwork. Now everything can be done electronically, and therefore turnaround is much quicker and much more effective. The third would be an increase in outreach and enrollment efforts. So there's more information. They're reaching out. They're extending this to a greater population, and they are making sure that everyone in the population is aware of the services that they are entitled to. Under the expansion, the federal government will pay no less than 90% of expansion costs permanently after states do so for the first 3 years. So here we have a couple diagrams which I feel are, for visual learners, a good representation of some misconceptions of Medicaid and how it's instituted and who basically it's covered. So the first diagrams here left shows that 63 million Americans enrolled in Medicaid, and a majority of them are children and families, with a much smaller percentage being the elderly and disabled. However, a disproportionate amount, $347 billion were used, but a majority of that spending was going to the elderly and disabled. So what's the reason for this? Basically, the graying of our population. Medicare, which covers the elderly, does not cover nursing homes. So who is going to pick up those costs? That is going to fall on the shoulders of the Medicaid system. Oops, sorry, we went ahead too quickly. The second one is a representation of the average annual growth of spending of Medicaid that is less than that of private insurance. So while people feel that Medicaid is increasing so rapidly, the truth is private insurance costs rise at a much higher rate than Medicaid. And in the third diagram, we have a breakdown of the low-income individuals, and it shows how children make up a much larger portion of the pie. Where does the future of Medicaid lie? So with state governments gaining more control to design their Medicaid programs, an integral question is whether modifications will further Medicaid's aim in providing health care for the underprivileged and disabled. And there are obvious differences across political parties that could create major shifts in requirements in terms of coverage, such as the work requirements we spoke of and mandatory drug testing. As reform is instituted and changes unfold, it is essential that our country's vulnerable population, the poor, the disabled, and the elderly, continue to have access to quality health care. Without question, public health care is in need of reform to remain sustainable. However, Medicaid is an indispensable program that must be nourished for our country's health and welfare to flourish.